Welcome to Science, Health and Healing Encyclopedia of Children's Health Core and Ali Academy. I'm Dr. Majid Ali. The subject of this article is Autism Cured in 1 in 4, Part 2. In June of 2012, an important paper published in the Journal of Autism and Developmental Disorders reported a 23.4% reduction in the incidence of autism. Let me explain to you. When they use the criteria of DSM V, their statistical manual for the diagnosis of mental disorders, by those criteria they diagnosed 111 children with autism and autism spectrum. When they applied the proposed DSM V criteria, 26 children were excluded from the diagnosis. In other words, by altering the criteria, they exonerated 23.4% of those children from the diagnostic label of autism. This is a crucial issue. Autism is a problem of blocked or impaired neurodevelopment, usually starting in toxic wombs. Before these babies are born, they are exposed to too much insulin, too much adrenaline, too much cortisol, too much of the low blood sugar episodes, not in all pregnant women, but unfortunately in a large number of women who are living with antibiotics, sugar, caffeine, and their life circumstances make them angry during the day, and of course at nighttime that continues. In kids123.org, the official website of Children's Health Core, a nonprofit foundation funded and founded by Talat, my wife, and I some years ago, there's a large number of articles that I have posted focusing on the biologic and neuroenergetic and neurochemical basis of the symptom complexes which are designated as autism. Autism is not a psychological disorder, it is not a psychiatric disorder. So these malignant games that they are playing by altering, I suppose somebody on the top is telling them, hey, you guys are diagnosing too much of autism and that's creating stress for us government officials. It's bad press. So what is their answer? We'll alter the diagnostic criteria. And by that, with one sleight of hand, they cured 23.4%, that is 26 children out of a total of 111. Again, that is an article published in June 2012 issue of the Journal of Autism and Developmental Challenges. The parents, the teacher, the enlightened, civic-minded individuals ought to be aware that these criteria that are being used to diagnose the suffering and the anguish of these children and their parents and their teachers, they are arbitrary, they have no intrinsic merit. The point that I make over and over is that what society needs is first to focus on issues of toxic womb state, and I just told you that. Gut fermentation in the mothers, leaky gut state in the expecting mothers, anger, frustration in the expecting mothers, the disruptions of neurotransmission. So the baby's brain is most vulnerable in the first 12 weeks of gestation when it is multiplying and developing rapidly. The brain cells or the premature cells are multiplying most rapidly and developing. And that's when they are exposed to toxins, mercury, lead, aluminum from mother's mouth or the mother's blood, pesticides, insecticides, diesel exhaust, products of yeast toxins coming from their fermenting guts. And of course, the leaky gut state allows all these bacterial and the yeast toxins to directly poison their ATP energy generation in the brain. Now, the brain really is the #1 organ in terms of its energy needs. So what do you think would happen if you block the energy generation, ATP energy generation in the developing mitochondria of the cells of these little children? Well, they will have serious problems of development. So I hope that these two segments, and I'm going to come back to this, they will raise this issue in part 3 of this series. Who profits from these changing diagnostic criteria? Who profits from calling children with autism and autistic disorders mentally impaired, and who uses their criteria for diagnosis? And who profits when the issues of nutrition, environment, and true neuroenergetic and neurochemical healing is impaired and blocked? I hope that by doing these 3 segments on autism cured 1 in 4, the title of this program will jolt some people to consider the deeper questions that I'm raising. Who profits from these malignant diagnostic games? Who suffers? How are these games used to sell drugs to the parents of little children? I never question the judicious use of drugs. What I do protest strongly is when psychologists and psychiatrists don't study nutrition, they are not aware of the things that I mentioned: food allergy, mold allergy, gut fermentation, impaired liver detox, functional nutritional deficiencies. In other words, they are not addressing any of the real issues. Please join us. Forward this YouTube segment to your contacts and visit our website www.kids123.org. There is so much information that I have posted. I present a biologist's view of these developmental changes and the challenges of these children. I categorically dismiss the artificial diagnostic criteria which have no real scientific merit, which are being used to diagnose these conditions. The society owes these children much. But you can't serve these children by playing around with diagnostic labels. Please look at part 3 of this series, Autism Cure in 1 in 4. Thank you. Thank you so much.